guys, and let's talk about muscles. Okay. All right. Okay. So hopefully you can see chapter 2, shoulder and arm again. Yes, a nod from somebody. Cool, thank you. We are going to talk about the biceps, the triceps, and the brachialis, and the coracobrachialis, and the pectoralis major. What I kind of want you to think about is last week when we talked about what muscle is this that I'm signing? Who can tell me? Somebody. Out loud. Miss Monreal is going to do it. Yes, tell me.
The pectoralis minor.
Pectoralis minor. Thank you very much, Miss Monreal. Don't go anywhere. What's the first rib it attaches to? Rib number what?
3.
Yes. And how many ribs does it attach to?
3.
Yes, so it goes to 3, 4, 5. How convenient is this? Thank you very much. We discussed the pectoralis minor last week. We discussed the serratus anterior. We discussed rhomboids. If you think about it, all those muscles attach.
Sorry to interrupt.
No, don't be. Go ahead.
But you look like you're throwing gang signs.
I am. Yeah. All right, so all those muscles attach to the scapula and move the scapula around. So those muscles, when we talked about the rhomboids coming out and the serratus anterior going this way and the pectoralis minor attaching to, these things move the scapula around. They protracted and retracted and lowered the scapula. The trapezius attaches to the scapula. They don't move the arm. The arm does come along for a ride, but they don't attach to the arm. Right? So when we start talking today about the pectoralis major, bis and tris and coracobrachialises, those attach to the arm. These are going to be arm moving muscles. These are going to move your humerus. So they're a very different set of muscles. You usually use them in conjunction with the ones that move your scapula around. Yeah? But these are very different muscles. So that's one of my trick questions that I'll ask you is, which of the pectoralis muscles, the minor or the major, move the humerus. It's the pectoralis major that attaches to the humerus and moves it around. Pectoralis minor attaches to the scapula and pulls it front and down. Very different muscles. They just happen to be in the pectoralis area. They do very different things. Sometimes you use them together, yes, but they do very different things. So I want you to kind of think about that because we're going to be talking about that with movement. Yeah? Okay. So before we jump into biceps and triceps and brachialis and coracobrachialis and pectoralis major, let's review the muscles we've done so far so that we can separate them and make sure they're all categorized in our head and properly filed away. Yeah? Yeah. Miss Hanson, did you get a good night's sleep?
I did.
Good.
But that's a problem. I don't normally drink coffee, so it's hard to wake up in the morning.
Yes, I hear that. I just hoped you were firing on all 8 cylinders because I was going to ask you some questions. Miss Hanson, what action am I performing right now?
Elevation.
Elevation of what?
Your scapula?
Yes, it's my scapula that's coming up. My arm is coming along for the ride, but it's my scapula that's being elevated, lifted up. What muscles have you learned about so far that could be responsible for that? I'm thinking of 2 right now. They'd have to be It'd have to be above my scapula to lift it up, right?
Trapezius.
Yes, trapezius, upper fibers, yes.
And
And what else could elevate my scapula? What else could elevate?
it's not this.
What else could
What is it?
elevate my scapula? What else could do that?
Is it this muscle right here?
Miss Hunter's laughing because I just almost said it. What muscle could elevate your scapula?
Levator scapula. How do you say that?
Yeah, you just said it. Levator scapula.
Levator.
Yeah, just take out like an elevator. Just take out the L. Levator scapula.
Scapula.
And trapezius. Thank you so much. Thank you, thank you, thank you. If we got really nitpicky, everybody, you could argue the rhomboids because they run up also elevate your scapula a little bit. But anyway, those are the two big ones, though. Thank you very much. Miss Yanez. Miss Yanez, can you tell me two muscles? Yeah, definitely two muscles well, first, what action am I performing here with my scapula?
Can you do it one more time? Sorry.
Sure.
That's a retraction, right?
It is a retraction. Give me another fancy name for it. That is 100% correct, by the way. It's a retraction. That's fine. But what's another name? What's happening to my scapula when I retract?
An adduction too.
Yeah. What two muscles are responsible for retracting, for pulling back, for adducting, getting my scapula closer to my spine?
The rhomboids major and minor.
Yes. Is there another muscle that the middle fibers can retract my scapula?
The trapezius.
Yes. And it's not ironic, it's the way it works, that these muscles all attach kind of to the scapula and tie to the spine. That's how they pull it over there. Yeah. Very good. Thank you. Okay. Miss Harper. What am I doing with my scapula now? Protracting, yes. My scapula is coming forward like this. What's another word for protracting my scapula? Abduction. These are fantastic answers, yes. Okay. Two muscles that abduct, that protract my scapula. Now, they'd have to be in front of me to pull it forward, so to speak, kind of. Could be. Sorry, I just had an itch. Don't mind me.
The scapula, is that the,
Sorry, I'm really itchy today. Wow. Oh. Probably need some.
the serratus?
Serratus anterior is correct. You are right. That's me kind of putting my hands down like this, everybody. That's serratus anterior. They kind of look like little finger-like projections right here, and that is one of the two correct answers that I'm looking for. What would be the second answer I'm looking for?
Oh, it's the pectoralis major or minor?
Which one is it? Which one attaches to the scapula?
It's like pectoralis minor?
It is. You're very correct, madam. The pectoralis minor hooks to the coracoid process of the scapula, and therefore it can pull it down and forward. Thank you. Well done. Really good. Don't make that face. You did great. Yeah, we just want you thinking, and you are thinking, and you're doing great. That was fantastic. Thank you very much. So we've got the stuff that retracts and protracts. We talked about the stuff that elevates, right? Miss Baladik, can you tell me a muscle? I can only think of one right now. Well, a muscle that does. Tell me what I'm doing with my scapula right now.
Depression?
Yes, depression. They are lowering, they're depressed. What would be a muscle that would depress my scapula? Which means if muscles can only do one thing, so it's got to be below my scapula so it can pull it down. Pull it down.
Latissimus dorsi?
That's actually not a bad answer. Although the latissimus dorsi really goes to the arm and pulls the arm down. This would attach to the scapula. It might attach to the lateral 1/3 of the clavicle, the acromion process, and the spine of the scapula, and attach it to the spine of your body. That could pull it down if you knew what muscle that was.
The infraspinatus?
A muscle that attaches to the lateral 1/3 of the clavicle, acromion process, spine of the scapula, and also attaches to your spine of your body here. All the way down to T12. In fact, it's those lower fibers I care about because they're going to depress your scapula.
Teres minor? I'm just guessing at this point.
Can you tell me a big diamond-shaped muscle on your back?
The traps?
Yeah, it's the lower fibers of the traps. Yeah, and by the way, I wasn't laughing at you. Like, I just thought it was very honest where you're like, I'm just guessing at this point. Yeah, that's totally fine. The lower traps, yeah, remember the traps insert into the clavicle, the acromion process, spine of the scapula, and the lower fibers are down here, so if they contract, they pull down the scapula. Very cool. Good. Thank you. All right, so those are muscles that, and by the way, you can argue that the pec minor depresses the scapula. It does in front too. It pulls it forward and depresses it down. But those are things that attach to the scapula, hook it to the body, and move the scapula around, right? Cool. And then we learned about 4 muscles that actually tie the humerus to the scapula, and these do move the humerus around in relation to the scapula because there's one on top that moves it this way, there's one behind that kind of rolls it back, 2 behind actually. So, Miss Felix Osuna.
Yes.
Can you see me?
Yeah, I'm seeing.
Cool. I am rolling my glenohumeral joint. I'm rolling my glenohumeral joint in. What kind of movement is that?
Medial rotation.
You're exactly right. Thank you, madam. Which rotator cuff muscle could be responsible for a medial rotation? There's a lot of muscles it could be, but which rotator cuff muscle? It would have to be one that's found in front so it could roll my arm in.
Is it the subscapularis?
Did you just say subscapularis?
Yes.
You are 100% correct. Thank you very much. She's right. It's underneath my scapula, but it's actually in front, and it rolls the scapula in. Very, very cool. Awesome, awesome, awesome. Miss Cooper. Miss Cooper, if I roll my glenohumeral joint out, roll it out, what's that called?
Adduction?
Nope. If I roll it in, it's a medial rotation. If I roll it out, it's a what rotation?
Oh, a lateral rotation.
Thank you. What
Okay.
no, it's fine. What 2 rotator cuff muscles are responsible for that? They would have to be found on my back. They have to be found on the back side of the scapula to roll it out. They're rotator cuff muscles. What?
Would it be your deltoid?
But first, let's name the 4 rotator cuff muscles. The one on top of the spine of the scapula is called the supraspinatus.
Spinatus.
The one found under the spine of the scapula is called the,
Spinatus.
and anytime I say for spinatus, you say teres
Teres minor.
minor. Underneath the scapula is
The subscapularis.
cool. We know it's not the subscapularis because that rolls your shoulder forward. What are the ones in back that laterally rotate your shoulder?
The teres minor.
Teres minor, and if teres minor is correct, then what else is correct every time?
The infraspinatus.
Thank you. That's exactly the kind of thinking I want. Thank you, ma'am. Yes. Miss Monreal. Miss Monreal. I am first. What action am I performing with my arm?
Abduction.
Abduction. Yes. Now, there are actually two muscles that we've learned about so far that can produce an abduction of the glenohumeral joint. Boom. One is a rotator cuff muscle, and the other one lays on top of that rotator cuff muscle, basically, kind of. What are those two muscles that can perform an abduction? They have to be kind of on the outside of my arm to cause it to do this. So we're looking for stuff that kind of attaches here so it can pull it, right?
Well, I know that one is the deltoid, right?
Yes, 100% correct. Good, thank you. That's this sucker down here. Boom. Now let's think of a rotator cuff muscle that would attach on top here so that it could lift the arm out.
Supraspinatus.
Bam! Thank you. Exactly. That takes care of the four rotator cuff muscles. Yeah. And remember, one of the big purposes of the rotator cuff muscles is not even to do all the stuff we just talked about, it's also to provide stability for the shoulder, because this ball and socket is a really crappy socket, right? Cool. All right. So good stuff, everybody. Really good stuff. Yeah. Yeah. Let's go on and learn some new muscles before I beat this part in the ground. We'll come back to this stuff later. Any questions so far? No. Okay. All right. Remember, the pectoralis major and the pectoralis minor really have nothing in common except they're in the same location. But they have nothing in common. And if you look at this picture here, Trail Guide page 62, on the left-hand side is the more superficial picture. You have to rip off the deltoid and rip off the pectoralis major to see the pectoralis minor and the coracobrachialis. These muscles run deep. Coracobrachialis and pectoralis minor run deep to the pectoralis major and the delts. All right. Boom. Okay. Let's talk about the pectoralis major. Do me a big favor. Do this for pectoralis minor really quick. Thank you. Because it goes to ribs 3, 4, and 5, all that stuff. It hooks the coracoid process. Do this for pectoralis major. Your pectoralis major is about the size of your hands. This is a pretty accurate rendition of where my pectoralis major is, especially if you spread your fingers out. Because it goes from ribs 1 to 6, and it hooks to the clavicle and the sternum here, and then it goes over to my arm, which means if it crosses over to my arm, which joint is it going to move, Miss Petrie? I've never asked this question this way, so I apologize. But which joint is this muscle going to move if it crosses over to my arm? Muscles can only move at a joint that they cross over. So what joint does this muscle cross over? Right here where the glenoid fossa meets the humerus.
Is it the glenoid humerus joint?
Yes, 100% true. Thank you. And I'm sorry, that was a new way of phrasing a question. What I want you guys to realize, you can't bend a joint unless you cross over it. Like, if I don't cross over this joint, I can't move this joint. I can move the scapula all day long, but I can't move this joint until I get across it and grab something over here. And then I can move it. Good. So the pectoralis major is going to affect movement at the glenohumeral joint because it crosses over it. Right? And by the way, it looks like this. Right? And it likes to insert into the crest of the greater tubercle. Remember, the greater tubercle is this big thing here, and it comes way over and grabs onto this crest right here. There's this ridge here. It grabs onto it. It's actually a fairly wide insertion because the pec is probably the second largest muscle in your upper body. Do you guys notice something interesting about the picture of the pectoralis major here? About the fibers? Just the way they look? Yep, there's 3 sets of fibers. Thank you, Miss Petrie. That is part of where I'm getting at. And what do they do when they go to insert? Do the upper fibers insert to the upper part of the crest? Do the upper fibers insert into the the proximal part of the crest of the humerus, the greater tubercle?
Yeah, it goes like really far, yeah.
They cross over.
But yeah, Miss Torres? What? What'd you say, Miss Torres?
They cross over. Sorry, just taking too long.
Yeah, it's okay. She's right. They cross over. Look at the upper fibers. The upper fibers actually insert lower on the arm. This will not be exact locations, all right? But it's very interesting. You'd think the upper fibers would go to the upper part of my arm. Instead, the upper fibers go to the lower part of my arm. The lower fibers attach to the upper part. They cross over. I didn't do the middle part, but they cross over.
Why?
Why? Thank you for asking. What do you think? What is the advantage of having the upper fibers grab really low on my arm?
Is it like stronger?
Well, also,
Is there, like leverage or?
it's a leverage issue, 100%. Everything is a leverage issue. By grabbing down here, they can aid in a flexion of the shoulder. And by grabbing, the lower fibers grabbing up here, they can aid in an extension of the shoulder, believe it or not. They can help pull it down. This one muscle can do a lot of stuff.
Poncho.
What? Who? Who said that?
I said that maybe in the control in the something for muscle.
It is control. So, one of the main things we think about our pectoralis major doing is horizontal adduction. And believe it or not, you all thought that. You might not have called it horizontal adduction, but this is why guys and people in the gym do, girls can too, I didn't mean to be sexist, but do bench press. I said guys because guys seem to do bench press all day long. That's all they know how to do. So they do bench press. Well, what am I doing when I do a bench press? I am doing an extension of my elbow, but what am I doing at my glenohumeral joint? What action is this? What action am I doing at my glenohumeral joint when I do this?
A medial rotation?
Nope. Medial rotation be turned in. What action is occurring here?
Oh, adduction?
Horizontal adduction. That's what this muscle mainly does. It does horizontal adduction. And Ms. Johannes is right. It can create a medial rotation because it grabs way over here and it can create a medial rotation. But in this case, when I'm bench pressing, I'm using all the fibers to do a horizontal adduction. Yeah? Boom. But there's other things this muscle can do. The upper fibers, because they're up here and attached down here, can do a, what's this called, Miss Hunter? What's this action called? Oh no, we lost you right at a crucial moment. Oh, there. I can't hear you. Oh, there. Now I can.
Did you ask me a question?
Yes, ma'am.
Okay.
What action is
Please repeat the
this?
question.
What action is this?
Is that extension? Extension?
Nope,
Oh.
it's in front of me, so
Uh,
what's the opposite?
flexion.
Flexion. It's in front of me, so it's flexion. Flexion front.
Alright.
And if I want to flex, I have to have something on top and in front to pull up this muscle. So the upper fibers are very good at that. If I want to extend, I need something to pull down. So these lower fibers that reach up high help me to extend back down.
So is it a synergist but an antagonist to itself then, or not really? I mean, because it's working with it, but it's pulling it down too.
Yes. I think you're 100% correct. I haven't experienced a lot of that in the real world, meaning it fighting with itself. But what I love, the reason you're 100% correct though, and you really are, is because you get the concept. If it can do a flexion, if part of it does a flexion, part of it does an extension, it can definitely fight in here, right? In theory, it could fight. Absolutely.
Okay, but is that, am I understanding the right terminology as far as like what an antagonist would be? An antagonist would be making it do the opposite?
Yes.
Is that what?
Yes. Yes.
Okay.
So just to put a finer point on that, you're right, but a finer point on that, when I'm doing a flexion, Miss Monreal, which fibers are responsible for this, the pectoralis major?
The upper?
Right, because they
or-
got to be on top. No, you're right. They got to be on top, right? And so who is the antagonist of a flexion in the pectoralis major? Antagonist.
The lower fibers?
Yes. Now, just so everybody understands, they don't stay that way forever. If I'm doing an extension, who's responsible for the extension?
The lower fibers?
And who's the antagonist to this move?
The upper fibers?
Yes. That's how, so you are using them 100% correct. I just wanted to kind of explain that antagonist and agonist switch.
So
Depending on what you're
even
doing.
though I'm just understanding the concept, that isn't something necessarily that would be referred to that though, correct?
You mean that they can argue with one another?
No, like that isn't, even though I was just trying to understand the concept, that isn't something that somebody would normally say, like,
It is not something that I've normally heard. That's
Okay.
that to answer your question. That, you know, I think you've already found there's some gaps in my mental ability. So, but I've never heard it referred to that way. However, you're using the terms completely correctly, and anybody who knew their anatomy well would think this young lady knows her stuff. They would get what you are saying. You are using it 100% correctly. I just haven't heard that much as I hear like about the trapezius upper fibers, you know, being agonist or antagonist to the lower fibers, depending on what you're doing.
okay.
I haven't heard as much because I just don't think we think about this muscle battling itself as much. Part of that, by the way, everybody, is pecs get tired from working out and stuff, but we don't find them to be, in general, by the way, everything I tell you, by the way, somebody will come into your office one day and prove me wrong. But in general, we don't find the pecs to actually be a major problem. Strangely enough, it's the pec minor underneath and some other stuff, the rotator cuff muscles, that we tend to have more problems with. I'll tell you what the pec major does that causes lots of problems, especially for weightlifters. The pec major is really, really strong, right? So let's say I bench 200 pounds, right? 300 pounds, whatever it is, boom. And I keep doing this, and I'm not doing it with very good form, and what happens is my tinier muscles get tired, like my rotator cuff muscles. So this big, massive muscle is moving. My rotator cuff muscles get tired, and as they get tired, my ligaments have to take over and hold this joint together. And then my ligaments get tired, and they get ligamentitis or tendinitis. It gets forms in here because this big muscle can tend to do more than the little muscle can, and it primes you for an overuse injury. And so pectoralis major and people using improper form in the gym and just lifting too much weight and not doing it right and doing it too often tends to lead to problems in the little rotator cuff muscles and the little stuff in there and the ligaments in there and things like that. And by the way, people love, I don't know about you guys, but try it out in class. People love having their pectoralis major rubbed. It feels really good. Most of us are kind of tight in here, but it doesn't seem to cause a lot of structural problems. Not a lot. That's not 100% true. You will see some people with kind of rolled in shoulders, and because this muscle can do a medial rotation, this is one of the things you'd look at is the pectoralis major. Yeah.
So if somebody had the rolled in shoulders, would, I mean, you would think pectoralis major, but then maybe would you think also like, teres major or the lats or, I mean, I'm like, the, subscapularis, the ones that are pulling from over here, is that working with it for them to have the rolled shoulders?
You can go back to bed now. That's about all I would like to teach today. That's fantastic. That's exactly what you would think. If somebody came to me with medially rotated shoulders, it's very hard to tell what's really going on, but you don't have to worry. You don't have to worry about rubbing the wrong thing in massage usually, right? So you already listed a lot. I almost went to tears. I was so happy. You got the pectoralis major can roll in, right? But then you remembered that the subscapularis reaches under and in front, so you got that one. Then you said teres major, which also medially rotates, and you were smart enough to remember that, by golly, if you say teres major, you better say latissimus dorsi or vice versa, so you got that one. And so far, I can only think of one that you've missed from the muscles we've learned so far, and it's the anterior fibers of what muscle can also do a medial rotation?
Deltoid.
Deltoid. I would work all those. And the reason I'm so happy right now, everybody, is that, I don't know if this is the exact percentage, but you just summed up about 50% of my philosophy in working on people, right? I find out the posture you have, I figure out what muscles could be shortened to cause that posture, and I loosen them all up, and I rub them all. And I know that sounds painfully simple, but you'd be shocked how many massage therapists out there, and this will not be you guys when you graduate, can't tell you what medially rotates the shoulder or something, right? So somebody comes in with a posture like this, and they're like, I don't know. You know, they massage their nose, that doesn't seem to help. They get their eyeball, massage their buns, it feels good, the person likes it, but it doesn't seem to help their shoulder problem. So yes, your thinking is spot on. It's what we want to do, and that's why we're learning this stuff in part so that we can look at a structural thing and say, people aren't supposed to look like this. This guy's really medially rotated. I'm going to start to look at what could be shortened. So anything that can cause the action, that's why we say what's contracted, what's shortened, of a medial rotation is stuff that we'd look at. Yep, and you just listed off like 5 or 6. Fantastic. Okay, back to pectoralis major. What I really want you guys to see, so you don't have to memorize all the actions, is the upper fibers are on top, so they can actually lift up. The lower fibers on bottom, so they can lift down, but we don't call this up. We call it a flexion. We call this an extension. If all the fibers pull, it can pull my arm in a horizontal adduction. Yeah? By the way, this is a neat one. Remember when I said weeks ago, I said like, hey, like if we described all the muscles used to do a pull-up, it'd be like almost all the muscles in your upper body? We think of pull-ups as building our lats. And that is the latissimus dorsi is the main pull-up muscle. There's just no doubt about it. Its main job is to pull my arms, adduct them, or extend them, right? But look what the pec does when it's way stretched up. The pec also aids in an adduction and an extension. Yeah. And the rear delt helps in an extension. Pull that back down. And we're going to learn some more stuff today that aids in extension. So when you're doing pull-ups, you're actually working the lower fibers of your pecs and your latissimus dorsi. And of course, if I said latissimus dorsi, you would of course say teres major. Major. Thank you.
So the middle fibers just like stabilize everything, like make it stronger, or what? If the upper fibers are bringing it up and the lower ones are having it come down, what do the middle fibers do?
Well, by the way, I slightly disagree with your book here. The middle fibers definitely help adduct your arm. They help medially rotate it, right? And this is where I disagree with your book, because it says just the upper fibers do this. They're wrong. The middle fibers help to horizontally adduct your arm. I argue all the fibers help to horizontally adduct your arm. In fact, they're dead on wrong on that. They are dead on wrong. They're claiming only the upper fibers help you to horizontally do this. They're dead on wrong. That's definitely middle fibers too. In fact, I'd argue it's more middle fibers than upper fibers. But by the way, everybody, don't get too caught up in like upper, lower fibers. I don't actually care about the fibers. I care about the directions they're going. Right? I just care that you know that there's these upper fibers running down here so you know they can cause a, what's this called, Miss Hunter, when I lift my arm up in front of me like that?
Flexion.
Thank you, ma'am. Yeah, so I just know that those fibers can do a flexion. And then I know I got lower fibers coming up here, so I know when they pull, they could do the opposite of a flexion, right? And Miss Nguyen, what is the opposite of a flexion? What's the opposite of a flexion? Miss Nguyen.
Yeah.
Yeah! What's the opposite of a flexion?
Do again. Abduction.
What's the opposite of a flexion? When I extend my arm back, what's the opposite of a flexion?
Extension.
Yes! Thank you. What's the opposite of an extension, Miss Nguyen?
Let me. You do again.
So you just told me this is an extension and you are right. What's the opposite of an extension?
Flexion.
Yes! What's the opposite of a flexion?
Extension.
Yes! What's the opposite of an extension?
Flexion.
Yes! Thank you. I'm not trying to make fun of you. I just try to drill the idea in your head. The opposite of a flexion is an extension. Flexion, extension, flexion, extension. So if muscles are going to fight, they'd have to do these opposite movements. Cool. Yeah. Cool. Hey, Miss Stanley. Miss Stanley, what action am I performing right now?
Well, technically, to me, you're drinking your coffee because that's where your screen froze.
I'm lifting my arm laterally out from the side of my body like I'm getting ready to take flight. Am I still frozen?
Lifting it. Yeah.
All right, I'm going to come back to you. I'm going to come back to you. Miss Cooper, what am I doing?
You're that would be, not elevation, it would be,
Although I like where you went with that.
I mean, when you go.
It's moving away from the midline. I'm
so
not,
It would be,
I'm
it
not,
would be abduction.
am I adding it back to the midline? Or what'd you say?
Oh, no. I said ab.
Oh, good.
I
Abduction.
did, I said abduction.
I believe you. It's just hard to hear. What's the opposite of abduction?
Adduction.
Cool. What's the opposite of adduction?
Of what?
What's the opposite of adduction?
Well, yeah, it's abduction, AB.
What's the opposite of abduction?
Well, now you're just depressing your arm.
What's the opposite of now I'm abduction. What's the opposite of abduction that I'm doing right now?
Well, it's not adduction?
It is.
Oh, okay, I see.
I'm just trying to drill a concept in
Okay.
until it goes like that for you. What am I doing now?
Well, now you're elevating your arms. You're doing adduction.
A what?
I said adduction or abduction.
Abduction. What am I doing now?
Now you're doing adduction.
Yes. What am I doing now?
And now you're doing abduction.
Yes. What am I doing now?
Adduction.
Yes. Show me an abduction right now with your glenohumeral joint.
And do like that.
Thank you. Show me an AD, an adduction with your glenohumeral joint. Thank you very much. Cool. Awesome. Okay, everybody. I just like to take like little detours so that we can drill in concepts. So we got the pectoralis major. It can do like 35 different things, right? Because it's got these upper fibers, so it can do a flexion. Lower fibers, it can do an extension. All the fibers can do a horizontal adduction. It can pull it can also add my arm back to my body, right? I don't care which fibers do that. I just want you to see that it gets stretched out here. If you ever want to test this stuff out, do the hand thing that I just showed you. Kind of hold onto your shoulder and see what actions pull you away from your shoulder, because it's going to do the opposite of those. Yeah. Yes, it is add the arm back to the body. Yes. Yes, 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 ma'am. Cool. Okay. And it grabs on. It's the second largest muscle in the upper body, which is why it grabs onto the crest of the greater tubercle. It's big. It needs something big to grab onto. It grabs onto the crest because it needs a lot of space of the greater tubercle. Right next to it in this big deep groove is latissimus dorsi. They're all grabbed in there. All this, you need power to pull your arm down when you're doing pull-ups. Cool, cool, cool. Questions about that? All right. All right. Miss Stanley, just to wrap up the pectoralis major for us, can you please, and you are welcome to read these, can you please read the origins of the pectoralis major for us?
Okay, the origin is the medial half of clavicle, sternum, and cartilage of first through sixth ribs.
Cool. What is the insertion?
Crest of the greater tubercle of humerus.
Yeah? And remember, everybody, they kind of go like this. They kind of cross over here, right? Which is why the lower fibers can kind of lift the arm up here, like that. Cool. Thank you. Yeah. Yep, and it is a superficial muscle. If I tore off my skin right now, the first thing you'd see is my pectoralis major. Then if I tore off my pectoralis major, you'd see pectoralis minor. Yeah. Cool, cool, cool. Awesome. Fun, by the way, I love working pectoralis major. It's a big muscle, you can grab it. There's all sorts of stuff you can get in there and get it. My favorite thing is to lift the arm out to get all the pec out there so it's exposed and I can go to town on it. And just because I said it wasn't like this major structural muscle, people love having it rubbed and lots of massage therapists don't rub it because it's by breast tissue and they're just terrified. And there's all sorts of non-invasive ways to rub the pectoralis muscle and people like it. And I'm making a big deal out of this because if you avoid too many things in your massage, all of a sudden you're missing huge parts of the body. And what you want is people to kind of go through your massage and be like, oh wow, nobody rubs me there. That feels really good. That's amazing. I've never had anybody do that. You want them to be thinking that, right? You want them to think your massage is very different from what they're used to and that you are covering more. You want to cover as much as possible in general. Okay. And by the way, little quote in here, but when working near breast tissue, communication is key. And I would say two types of communication. Talking to your client, yes, just like, are you okay with this? But please watch body language. Because lots of people say something's okay, but their body language says it's not. Why might somebody on the massage table tell you it's okay when they're feeling it's not okay? Anybody? Why might somebody tell you something's okay? You asked them, like, hey, is it okay for me to work in here? Are you comfortable with this? And they say yes, but their body language is telling you no. They're lying. Why would they lie to you?
Maybe they don't want to be embarrassed of being uncomfortable. Maybe they'll think that you're gonna think they're weird or whatever.
Yeah. Who's naked in the room, by the way?
They are
Yeah, who's fully clothed?
the therapist.
Yep. Who's laying down?
The client.
Who's looming over them?
Therapist.
Yeah. Can you imagine me? I got 25 years experience as a massage therapist. Come on, and 220 pounds of me leaning over you. Are you okay with this? Sure. Right? So I really listen to like the tone of your sure. Like if you're like, oh yeah. I'm like, oh, this person gets massage all the time. They're fine with what we're doing. It doesn't mean, by the way, that I change boundaries. I'm not going to touch any breast tissue or anything, but I'm listening for that. I don't care what you said. I care how you said it. But if you're like, yeah, I'm like, oh, we're not going to start working down this person's sternum and stuff. We're going to be kind of careful here. Like this person is acting as though they are scared or uncertain, right? Sorry, did I miss something I should have seen? Sure isn't a definite yes, that's right. And so really listen. I watch body language too. If they come in and I'm like, hey, my name's Mike, I'm going to be your therapist today, and they like tighten their robe up around them, I'm like, oh, you've never had a male massage therapist and you are freaking out right now. Or something like that, right? I'm not going to be like, let's get on the table and work on your glutes. Right? I'm going to ease you into that concept. You know, whereas you get other people, and my massage therapist in the room will attest this, other people who come in and they're taking their robe off like while they're talking to you. And you're like, oh, okay, you get on the table. They're totally comfortable. They've gotten 1,000 massages, whatever. So anyway, just read your client. It's not just verbally what they say. I've heard a lot of people say, but they said it was fine. It doesn't matter what they said. Get a read from them. You know? Yes, Miss Petrie, we can't hear you though. But I saw you raise your hand. Oh, now I can.
You can hear me now?
Yeah.
Okay, good. Actually, I have a question about working on the pectoralis area.
Yeah.
I want to know if the first lab class has already gone through this, working on the pectoralis area. I know that Mr. Ybarra, the second class is all women. Mr. Ybarra doesn't really feel comfortable
Coming in?
with that. So I wanted to know if the first class is already there, and if so, if
No?
actually question maybe for Jack if he could stay and like do and Mr. Ybarra could feel comfortable showing us on him.
Yeah. How about I hesitate to jump in. However, I feel like this is something that I'm good at. Like you know me, I've had to work with women my entire life. All my clients have been women. I've always managed. I feel like I'm very good at showing how to do this in a way that respects the client. So maybe I'll come into your lab classes if you guys are comfortable and actually demo on anybody who wants to, and I won't demo on anybody who doesn't. You're never under any obligation to do this. But if you're like, yeah, I want to see how you pull this off, if I show you, I think you'll realize how much of the pec you can get without really violating somebody at all. So maybe I'll do a guest. I've got to talk to Mr. Ybarra, but I'll see about doing like a guest performance on the pectoralis major, because it's important, because people love it. They love it. They love it. Yeah.
I also did like how they referred to that on the video, but I also think that it would be good to see you do that. Not that you're going to come into our class, but the second class.
No. I was talking about coming into both.
Oh, into both? Okay.
I'm not going to do one for one
still,
unless you don't want me to, but I was going to come to both.
No, that's fine. I still think it would be beneficial just to even see what you would say, how you would communicate with the person.
That's actually part of what I want to show, yeah. About how you kind of approach the whole thing. Yeah. And strangely enough, it's something you have to be really respectful of, but also very sure of yourself. Because if I get too nice sometimes translates as timid, and timid actually makes you on the table more nervous. You want to know that the person touching you knows what they're doing. So yeah, we'll go through all that. Cool. Thank you, Petrie. Good point. Yeah. Okay. Moving right along. Boom. Okay. I just want to make sure I didn't pass something. Let's talk about the biceps brachii. Do 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 do. Boo. The word bi means what? Two. Thank you. And do you know, sir, since you're on a roll, do you know what the word seps means? C-E-P-S.
Like 7.
That is actually a really good guess. In this case, it means heads. Seps means heads. I think it's sep that means 7, but anyway, you were really close. So bicep means two-headed muscle, right? And what does brachii mean?
Arm.
Yeah. This is the two-headed muscle found on your arm. That's what it means. Biceps brachii, two-headed muscle found on your arm. So this thing has two origins and two insertions. This second, oh, go ahead.
Would you like me to say them? Or
Oh.
you-
Oh, no, sorry, sir. Yeah, I realized we were conversing, but I'm just rambling now. No, you're fine. You're fine. This muscle has two origins and two insertions. Who can tell me how many joints this muscle crosses over?
Two?
Yes. Does that mean it can move at two joints? Yes. Is Mr. Tapscott obsessed with muscles that cross over two joints? Is that likely to be an end of the year test and something he will talk to you about a lot? Because structurally speaking, when muscles start to cross over more than one joint, they can affect you in all sorts of funky, interesting ways. So this muscle, because it attaches into the scapula and goes across your elbow, it's crossing over the shoulder joint and the elbow joint. It can move the elbow and it can move the shoulder. So let me say that in a fancy way now. Because this muscle has an origin on the scapula, right, at the supraglenoid tubercle, which is the tubercle above the glenoid fossa, and the coracoid process, and it crosses over the glenohumeral joint and inserts into the radius and the aponeuroses down here in your forearm. It's also crossing over what we call the humeral ulnar joint, because this bone back here is your ulna. You got two bones in your forearm, your radius and your ulna. Your elbow right down here is formed by your ulna and your humerus. So this is your humeral ulnar joint. Glenohumeral, humeral ulnar joint. That's your elbow. And the biceps brachii crosses over both. We always think of the biceps as allowing me to do this. What's this action, Miss Hunter? I don't know. Miss Hunter? What's this action?
This is a flexion.
Yes, it happens in front. It's a flexion. Yeah, that just helps me remember. Yeah, flexion. Yeah, flexion, flexion, flexion. Anyway, flexion, right? We think of the biceps brachii as doing flexions, and they do. They do flexions. And so people are like, I'm working on my bis. I'm curling, right? I'm doing flexions. Yeah, and that is one of the main things that it does. But it crosses over my shoulder joint, so if it tightens up here, if it contracts and shortens here, Miss Hanson, what is this action called?
Flexion.
It is a flexion also. Flexion of what joint?
The glenohumeral.
Exactly. So it can, it's not, by the way, it's not the main flexor of the glenohumeral joint, but it is a backup. It can help flex the glenohumeral joint, and it can also flex the humeral ulnar joint, which is what we may mainly think about it doing. It also does one other thing that's really interesting. Because of how it runs down and attaches to my arm, when it pulls, it causes me to turn my hand up as though I'm going to hold a bowl of soup. Yeah. Yeah? Cool. Miss Nguyen, what do you call this action when you turn your hand as if to hold a bowl of soup?
Extension.
How about something with soup in it? Soup in
Soup in
nation.
nation. Soup in nation.
Supination, yeah. Holding a bowl of soup, supination. Thank you. Hey, Miss Nguyen, don't go anywhere yet. if I flip it over, I'm prone to dump out the soup, and we call that say
Pro
nation.
nation.
Supination,
Supernation.
pronation.
Pronation.
Supination,
Supernation.
pronation.
Pronation.
Cool, thank you. So because this muscle attaches into my arm here, when it pulls, it can supinate. It's a powerful supinator. It is actually the only supinator I can think of your forearm. It is a supinator of your forearm. It actually lets you turn stuff. And you do this all the time when you turn a doorknob or turn a screwdriver. Watch this. So this is my bicep, right? Look what happens. Can you see it move just a little bit when I supinate? It actually, it contracts more. There's a reason bodybuilders flex like this and not like this a lot. Like this is not a fully flexed bicep. When I turn this way, it actually balls up more. You can try it on yourself. If I supinate, I actually get more of a bicep. If I was more muscular, this would be more impressive. Sorry, everybody. But it is a powerful supinator. It supinates my forearm. It's another thing it can do. Yeah? Let me see if I got a model of this, by the way. I think I do. Cool. All right. So, this is supposed to be a model of the biceps here. It's not a very good model. You don't see the shoulder up here where they're running to, and that's really what we care about. But they come and they insert down here into two spots. One goes into your radius, which is this bone down in here. There's a tuberosity on it, the radial tuberosity. And the other one weaves into the fascia of your arm. It literally disappears into the what did Miss Monreal call it? The spider web down here, which is really helpful because when it contracts, it causes a flexion of the humeral ulnar joint. Yeah? Oh, I just noticed something. Your book says it flexes. Oh, good, it does. Okay, never mind. Never mind. I thought there was a mistake in your book that I disagree with, but there's not. So, there's one other weird thing in the book that we haven't talked about yet, and I have to show you somehow. You've got two forearm bones. My forearm. You can feel them, by the way, in your forearm. This is my ulna. This is my radius. If you are not touching your arm right now, I feel sorry for you. This is my ulna. It makes up your elbow. And this is my radius. It goes to your thumb. So yes, it's my ulna, my humeral ulnar joint that makes my elbow. But when I supinate, my radius actually twists around my ulna. It actually twists around my ulna. There are times your forearms are crossed. The bones in your forearms are crossed. And so we call this joint between the radius and the ulna the radial ulnar joint. Let me make that clear. Right now, my ulna is here, okay? And my radius is here. Watch what's they're running parallel. Watch what's gonna magically happen. My radius is over here now. It crosses over and back. My ulna crosses over this way. They actually crossed over each other. They're crisscross right now. They actually went like this and went like this. That's how I rotate my hand. Yeah, we're going to get to forearms later. It's actually one of the last things we do because they're not super structurally important, but they're fascinating.
What is it called when they cross over?
Well, it's called pronating, actually. They cross over when they pronate. When you're supinated completely, they're parallel. When you pronate, the radius crosses over the ulna. It actually comes over. It actually goes like this, Miss Petrie. It goes, whoop. And that's how you flip over. That's how you turn your hand over. Boom. Kind of crazy. Kind of crazy. Anyway, the bicep does the opposite thing. It grabs onto your radius and pulls it back. It supinates it. Yeah? Yes. So Miss Nguyen,
Yeah.
what's this called?
Supina.
Yeah, supination. And what's this called?
Sponation.
Pronation. Good. So let's just say them one more time. Say soup
Soup
in
in
nation.
nation.
Supination.
Soup in nation.
Supination. You're saying it right. You're saying it right. I just want you to say it a couple times. Supination.
Soup in nation.
Beautiful. Pro
Pro
nation.
nation.
Pronation.
Pro nation.
Pronation.
Pro nation.
Supination.
Supernation.
Pronation.
Pro nation.
Supination.
Supernation.
Pronation.
Pro nation.
Supination.
Supernation.
Pronation.
Pro nation.
Thank you, and thank you for being so patient with me. Cool, everybody.
Thank you
good.
for having me to talk about that.
Yeah, I think it's good. By the way, I'm not just doing this for Miss Nguyen's benefit. I'm doing it for her English benefit, right? But also, it's just good for you guys to think supination, pronation, supination, pronation, right? I actually advise you all to be doing it with us because you learn when your body does the movement, right? You're studying movements. So if you're not moving when we're studying movements, that's kind of weird. Okay. Anyway, so that's the biceps brachii, right? Remember, the biceps brachii crosses over two joints so it can move two different joints. We're going to take a break in just a second because I just feel like we need it. But I want to ask you a question because we need to start putting some other concepts together. So with the biceps brachii, if it flexes my humeral ulnar joint and it flexes my glenohumeral joint, how come every time I use it, don't I do this? How come I just use it sometimes just do one joint or just do the other joint?
Can you just, it's because you can just isolate the one joint you want to use, right?
That is the correct answer, but how can I isolate the one joint I want to use? How do you isolate?
Maybe because you stabilize the other ones with the other muscles?
Yes, exactly. So I'm oversimplifying here, but let's suppose my rear deltoid does an extension, right? So if I lock my rear deltoid, you're not thinking about this, by the way, your brain does all this for you. If my rear deltoid engages, my arm can't flex. And now all my bicep can do when it pulls is lift and bend the elbow. If my rear deltoid didn't engage, my arm would come up too. So your brain is constantly using antagonists and agonists and stabilizers to your benefit to shut off certain things that a muscle could do. The muscle doesn't do it. Muscle only knows this. The muscle just says, I'm going to contract and try to get these two ends closer to each other. So the muscle of your bicep is just trying to get this closer to this. It doesn't care if it does that by lifting the arm up or bending this in. In fact, it will just do both. But my brain can stop some. If my tricep locks, then all my bicep can do is lift my shoulder. It can't bend my elbow. If my rear deltoid locks, right, then all I can do is curl. Just something to think about. We're going to talk about it more, but I just want to explain to you why there's all these actions, but you don't perform them all at once, right? Because sometimes your brain stabilizes other stuff and stops it from working on purpose for the right reasons. On that note, I think we should take a 5-minute break because I see a little smoke coming out of some people's ears. That's good. All right, 5-minute break. 9:29. See you at 9:29. 9:29. 9:29. Oh. Okay. So we are still talking about muscles that cross over the glenohumeral joint. Some of these, like the pectoralis major, crosses over the glenohumeral joint. The biceps cross over the glenohumeral joint. Granted, the biceps cross over a whole lot more than that, but we are kind of talking about muscles that can affect the shoulder because we're still in the shoulder section. Yeah? And by the way, that's just, again, the way somebody decided to divide up the body. Right? We could have taught all this anatomy a very different way, just so you want to think about it. We could have taught all this anatomy, and we could have said, what are all the muscles that cause a flexion of the shoulder? And just looked at those, right? But we didn't really do that. We kind of said, let's look at the muscles in this group, and the muscles in this group, and the muscles in this group by what joints they cross over. That's why I'm going back to you and asking questions in different ways to try to get you to think about anatomy in different ways, because people people don't move by just moving their glenohumeral joint and then just their scapulothoracic and then just their elbow and things like that. That's not really accurate. Okay. That's biceps brachii. Most literally, Miss Stanley, what does biceps brachii mean?
Biceps, it means like the two head muscles, and brachii is it's like the part of the arm. I don't know.
Yeah, just the arm. Yeah, your upper arm, because they call your lower arm your forearm. So your arm. So it's the two-headed muscle on your arm. Thank you. Thank you, thank you, thank you. And how many joints does it cross over, Miss Petrie? 2. Yes. And it can cause a flexion, Mr. Kondaris, of what 2 joints? What are their names?
GH joint, and it's that, you just said it's the gleno, it's another gleno.
No. Humeral.
No?
Humeral ulnar joint.
Humeral ulnar joint, okay.
Cool, yeah. So, glenohumeral joint and humeral ulnar joint. Yeah. Cool. And then it can cause, you can supinate, and when you supinate, Miss Hanson, you're actually moving a different joint. You're moving the joint where your radius rolls over your ulna, and we call that your radial.
The tuberosity of the radius?
But we call that joint your radial ulnar joint. Because they roll over each other. I didn't introduce this a lot. This is just really quick because we're really more interested in what's going on up here. But yeah, anytime 2 bones interact, we usually name the joint by those 2 bones or things around them. Yeah, so that's the radial ulnar joint that is supinating. There's action occurring here. They actually start crossed over and they flip over into a supination. Yeah. Miss Nguyen? Miss Nguyen? Where'd you go? Miss Nguyen. Yeah? We're going to come back to you. Give you 1 second. Oh, Miss Nguyen? Thought I heard you. Oh, that's you, Miss Hanson. All right. Okay. Biceps brachii is a very superficial muscle. It is very easy to palpate. What does palpate mean? Don't overthink it, Miss Cooper.
Palpating is just feeling the muscles.
Thank you. Feel, touch, rub, squeeze, whatever. Yeah, thank you. It is very easily palpatable because it is very superficial. It is the top bicep muscle. Yes. When guys go to the gym and they want to get big arms, they do lots of curls, and they're like, I'm working my biceps to get really big arms. Strangely enough, this is not the largest muscle on your arm. It's not even the second largest muscle on your arm. It's actually the 3rd largest. So they're kind of going about it the wrong way. Also, this bicep tendon that goes into the supraglenoid tubercle runs through a groove It runs through the intertrabecular groove where the lats insert. It also runs through here. This groove is sometimes called the bicipital groove. Has anybody known somebody where their bicep tendon has fallen out of the groove, popped out of the groove? It happens. And a doctor actually has to find the tendon and pop it back in. Yeah. Miss Nguyen, you're back. You were gone. I called on you and you weren't there. I took it personally, which is why I'm going to ask you a couple questions really quick. What am I doing right now? Supination?
Supination. Pronation.
Yeah. Supination?
Supination.
And what muscle did we just learn about that lets me do a supination?
I think in the short hair.
Yeah, it's called the bicep brachii. You're right by biceps, but there's actually another bicep on your body. Biceps brachii. Bray.
Right.
Key.
Key.
I.
Brachii.
Biceps brachii. It means the two-headed muscle on the arm. You have a biceps femoris down on your leg. That's why we have to make that distinction. You have another biceps muscle on your body. We just don't talk about it very much.
Say again, bicep.
Brachii. Break.
Right.
E.
D.
I. Brachii.
Bicep. Brachii.
Yeah. Good job. Hey, you're not the only person having a hard time with these names. Trust me. Right? I mean, I think everybody else would nod. Because everybody else is like, is that right? And have you guys started to notice that Mr. Ibarra and I say them differently? Because it's a language, and so people interpret it slightly differently, right? And if his teacher said it differently, he learned it slightly differently. So, of course, I'm right. I mean, of course.
I know
But-
a lot.
no, I'm kidding. And if you hear people from England say it, it's kind of funny too, because they say it slightly differently too. And you can go online and get the pronunciation. It's fun. Anyway, biceps brachii. Yes. Okay. If you tear off the biceps brachii, you get to a muscle that should not even be in this section. Mr. Tapscott put it in this section. It should not be in this section because it's not a shoulder muscle. It does not move the shoulder. I put it in here, though, however, because I thought it was not a good idea to teach you about the biceps brachii without teaching you about the muscle right underneath them. So right underneath my biceps brachii, is another muscle that runs deep to that. And that is the brachialis. The brachialis runs from the distal half of the anterior surface of the humerus into the ulna. We'll get to more specifically into the ulna in a second. I want to, Miss Torres. Miss Torres, let's talk about this confusing language that they've got. The distal half of the anterior surface of the humerus. That's where this thing starts. Can you tell me what distal means?
Away?
Yes. So what they're saying is if you took the humerus and divided it into two sections, you'd have a distal half and a proximal half. This thing has an origin on the distal half. Yeah? If you put your hand, by the way, on your arm here at the distal half, you'll notice it's a lot thicker than the proximal half until you get to your deltoid. But the bicep feels a lot thicker down here, and that's because the brachialis is underneath it. So this is the distal half. What does anterior mean, Ms. Torres?
And?
Anterior means front. So they're saying the distal half, the further away second half of your arm, in front. And remember, this is me standing in anatomical position. This is in front, right? surface of the humerus. What's the humerus, Ms. Torres?
The bone?
The bone, thank you. So they're saying, you can find this thing if you take the humerus, divide it into two halves, go to the distal half, on the anterior side, it's on this side, right, of the humerus. That's what that means, that big, long, confusing thing means. That's why we need to know words like distal and proximal and anterior and posterior. Yeah? So, Ms. Torres, what does anterior mean?
Front?
Yes. What does posterior mean?
Back?
Yeah. What does distal mean?
Away?
Yeah.
The trunk of the body?
Yeah. And what does proximal mean?
Towards the trunk of the body.
Thank you. Awesome. Thank you, ma'am. Okay, so the brachialis, believe it or not, is actually a larger muscle than the biceps brachii. It is the muscle responsible for giving most of the size to the biceps brachii. It crosses over the humeral ulnar joint. The humeral ulnar joint is a fancy name for which joint, Miss Monreal? The humeral ulnar joint is a fancy name for which joint? No, you paused right when you were coming over. It's so weird. Okay. Miss Cooper, the humeral ulnar joint is a fancy name for which joint?
Humeral, did you say humeral ulnar?
Yep. Humeral ulnar joint is a fancy name for which joint?
What, the GH?
It's a fancy name for which joint? What do you call this? Before you came to massage school, what did you call this?
Oh, your elbow?
Yes, it is a fancy name for your elbow. Thank you. Okay. So this muscle crosses over your elbow. That's the only joint it crosses over. Yes. What type of joint is the elbow, Miss Yanes? What type of joint is it? I'm not really into joint types that much, but this one's kind of interesting because it kind of shows you something. What type of joint is the elbow joint? Is it a ball and socket?
Is it a hinge?
It is a hinge joint. Hinge joints can only do flexion and extension, right? And this muscle can only pull, so what's the one action the brachialis can do?
Flex.
Yep. Flex the humeral ulnar joint. That's it. That's all it can do. That's all it does all day long. Its whole job is this. It is actually your main curling muscle. The biceps brachii help a lot, don't get me wrong, but it's the main guy. That's all it can do. That's all it does. It's fully dedicated to that. Cool? So I just want to go over that really quickly with you. We're actually going to look at the brachialis at some other point when we're down on the forearm, but I wanted to kind of explain to you. You just learned about the biceps brachii. Right underneath it, when I grab on top here, I'm grabbing my biceps brachii. When I reach around it and grab underneath it, I'm grabbing my brachialis. Yeah? Yeah. Okay. I'm not going to spend any more time on that. Bam. It too is palpatable, especially from the sides. Yeah. If you want to put movement into your massage, you could grab this, since I see one of you doing it, and move your arm. You're actually causing the muscle to move underneath your hand and making it massage itself. Today when we do pecs, this is a trick I'm going to use when we do pecs. And if you are somebody that I'm doing it on, you will feel it. But we'll get to that later.
I've been waiting for X.
Yeah. Yeah. Cool. All right. The largest muscle on the arm is actually not the biceps brachii or the brachialis. It's the one muscle that lives on the posterior side of the humerus. Posterior side of the humerus. Miss Harper, what does posterior mean?
Mean the back.
Yeah, back, behind, rear, whatever, down. Awesome. This is the muscle that lives on the back of my arm. The name of this muscle is triceps brachii. Miss Bilotic, what does triceps brachii mean? Based on what you know about biceps brachii, what does triceps brachii mean?
2.
Well, have you ever ridden a tricycle
No.
when you were little?
Oh wait. Yeah. So 4.
Not a quad, not a quadcycle. So when you rode a bicycle, how many wheels did it have? A bicycle.
2.
Okay. When you ride a tricycle, how many wheels does it have?
3.
Yes. So what does triceps brachii mean?
3 muscles.
What does seps mean?
Seps.
Yeah, the word seps. Tri means 3. TRI means 3. What does seps mean? CEPS.
I don't know.
Seps means heads.
Oh.
So this is the 3-headed muscle. And what does brachii mean, Miss Bilotic?
On the arm.
Yes, thank you. So this is the...
Sorry, I got confused because I thought you meant like, you know, the bicycles that kids would ride? I thought there were 2 little wheels.
Yeah, it's totally okay. You didn't do anything wrong. It's hard to interpret the questions too. You're fine. If you're participating, you're fine. And also, knowing all about tricycles and bicycles was not a prerequisite for the course, so you're fine. So it is the 3-headed muscle that lies on the arm, right? This one happens to be in the back of the arm. By the way, it's 3-headed. It's actually very powerful. Your triceps are very powerful. When you are doing a bench press, I'm oversimplifying, but the pectoralis major is causing you to do, what's this movement that my glenohumeral joint's doing? Go back to pectoralis major for a second. What's this doing, everybody? What's this movement?
Horizontal adduction.
Thank you, sir. And as I'm doing that horizontal adduction, what is my humeral ulnar joint doing, Mr. Gondaris?
Sorry.
As I'm doing this horizontal adduction in a bench press, what's happening at my elbow? What action is happening at my humeral ulnar joint, my elbow? Extension. And the tricep is your major extender. So bench press is a pectoralis major triceps exercise. It also works your front deltoid, but let's not overcomplicate things right now. So in order to do a bench press, I need these 2 muscles a lot. Big tris help, big arms in back help, and a big chest in front helps. And this is kind of an answer when I said in the beginning of class, if muscles can only pull, how do I push? Well, my tricep actually pulls on my elbow to extend it. It actually pulls on my elbow to extend it. It actually grabs onto the back of my elbow and pulls on it to extend it. That's what my tricep does. Right? Right. It's got 3 heads. You can't see one in the picture because it's deep to the other 2. The medial head is deep to the other 2. Right? In describing the origins for this muscle, your book uses words like proximal and distal as well. Have you ever seen, oh gosh, maybe they have a picture here. No, they don't. Bear with me, everybody. I want to pull up a picture for you really quick because I think it'll make things a lot better. All right, bear with me. I'm just pulling up a picture to make a point to you all to make your life easier, believe it or not. That's the concept. Come on, people, give me a good picture of a tricep. Aha! Oh, stop that. Sorry, buddy, bear with me. Okay. Let's see. Perfect. All right. Let's see here. Hold on. I think this will make life easier on you, which is why I'm saying hold on. Escape, good. Come on. I'm going to. Good. Okay. All right. Come on, picture. Let's crop it. All right. Can we all see the picture? This is actually a picture of my arm. Can we all see it right now? In the slideshow? I don't know why you're laughing right now. Anyway, this is just me last week. I haven't worked out this week, so I couldn't show you on myself right now. Do we see this? We call it the horseshoe shape. Do you see the horseshoe shape here? The outer part of the horseshoe is the lateral head of the tricep. The inner part is the long head of the tricep, but the outer portion of the horseshoe is the lateral part of the tricep. And by the way, if you look at somebody, quite often the lateral part is short and the other head part is long because it's the long head. But that is somebody's tricep. Underneath all that is the medial head. But do you see how high up the lateral head is? That's how I remember the lateral head is attached to the proximal half of the posterior humerus. The proximal half. Because, let me start up the slideshow again here. Slideshow, current slide. Boom. Oh, wow, I put it in the wrong place. How terrible. All right, doesn't matter. Anyway, it's on the proximal, the lateral head is on the proximal part of the humerus. Proximal means what? Means the closer part of the humerus, right? Distal is the further part away. Yeah? So, when we look at the triceps, it's the lateral head that we were seeing so well on that person. The long head forms the other side of the horseshoe, and the medial head is underneath. It just gives thickness to the whole arm. The medial head is actually, you can feel it down in here. How many joints does the triceps cross? Anybody? Bathroom is not a joint. Thank you, Miss Hunter. How many joints does the triceps cross? Three joints? Miss Petrie? Miss Petrie, I'm calling you out. You said 3 joints. What 3 joints?
I think in the hammer clavicle.
The
Hammer.
humeral ulnar?
Yeah, it's a joint.
Okay, so you just mentioned the elbow joint, and it's called humeral
Humor.
ulnar.
Honor. Yeah,
Hu-
humor honor is a joint Glenn in the hammer joint.
Yeah, gleno.
Hammer joint.
Yeah, but say gleno first. Gleno. Say gleno.
Gleno.
Humeral.
Humor.
Glenohumeral. You're okay. It's a hard letter in your glenohumeral.
But I know the 3 joint.
Wait, that was 2 joints. Is there a 3rd joint? I'm not saying there is. I'm asking. Anybody? Are we going for a 3rd joint?
Well, I'm just, the thinking that if there's a long head, a lateral head, and a medial head, don't they all have to attach to something?
They do.
Each one?
They do. They do. So, but
So would
you've
it be 3 different joints that they attach to, or are they
Well,
attached
remember-
to joints?
remember, no muscle attaches to a joint. Muscles cross over a joint,
Okay.
right? So you can look at the origin to find out where they attach to. The lateral and medial heads attach to the humerus, either proximally or distally. The long head attaches to the scapula.
Okay.
So how many joints are we guessing? What?
2.
2. Good job. So the main job of the triceps is to do this with my arm, right? Do this with my arm, right? Okay, cool. Miss Bilotic, by the way, what's this action that I'm doing with my humeral ulnar joint, my elbow?
Flexion?
Nope, opposite of flexion.
Extension?
Cool. Yep. I'm extending. I'm opening up my arm. Cool. And the triceps extend the arm. That's the main action. But because the long head crosses over to my scapula, when my arm is up like this, it's stretched out. The long head is stretched out, which means it can pull my arm down like this. And if it's in front, it can pull it down like this. Yeah. Yeah. Miss Yanez, what is this action here called? Well, let me do it like this to keep it straight.
Adduction.
Adduction of the glenohumeral joint. What's this called?
An extension.
Extension. The triceps can actually pull the arm down to the body. Do we know another really, really large muscle that can do an adduction and an extension of the glenohumeral joint, Miss Yanez? Big muscle.
Is it
Big, huge muscle that pulls my
latissimus dorsi?
Yeah, yes. So the triceps actually aid the latissimus dorsi in a pull-up, even though their job is to push stuff away. In this case, they can actually help pull the arm down to the body. Yeah, so latissimus dorsi, by the way, if the latissimus dorsi and the triceps help in a pull-up, what else helps in a pull-up? If I say latissimus dorsi, you say?
Teres major.
Teres major, yeah. Can rear deltoid help pull down my arm? Is it stretched out here?
Yeah.
Yes, absolutely. Can my pectoralis major, especially the lower fibers, help adduct or extend my arm?
Yes.
Wow, that's a lot of muscles already helping our pull-up, and I don't even think we're done yet. Very interesting. Thank you very much. Okay. All right, so the triceps brachii main job is it crosses over the elbow here, which we call the humeral ulnar joint, and it pulls to extend my arm, But it also crosses over the scapula, so it can aid in an adduction or an extension. Yeah? Yeah. Very cool. We're going to find that there are a lot of muscles that cross over the back of the armpit here, which we call the posterior axillary border. We're going to find that there's quite a lot of muscles that cross over here. Yeah. I call areas, this is Tapscott, this is not something you're going to read about in the book, but I call areas where there's lots of muscles that can be found together like high priority targets. It means I can rub that area and hit lots of muscles at once, and people tend to really like it, right? So you guys are learning that there's a lot of muscles back here in this axillary border that form the axillary border, that form the back of your armpit, right? Mr. Kandaris, can you tell me a muscle that forms my axillary border back here? Something that just crosses over, it's behind you, crosses over this area. Goes over the arm.
Goes over the arm.
Yeah, just give me one. Something makes the back of my armpit. Something. There's a lot of right answers to this. Something back here.
Armpit would be axillary, right?
Axillary region, posterior border. The back side of my arm here goes from my back or my scapula over to my arm, back behind here. Can you give me one muscle?
Like one muscle in that region.
Yes.
Brachialis.
Now my brachialis is on the anterior side of my arm.
Oh, right.
We're talking about posterior.
I guess the back head of the deltoid would be one.
Yes, it's not called the back head of, well, sorry, the rear, all right, rear fibers of the deltoid. We'll take it. We'll take it. So he's describing this, everybody. He's describing the rear fibers of the deltoid. I'll take that. Rear fibers of the deltoid are back here. That's one. Miss Hanson, can you give me another one? Just one.
The serratus anterior?
Not really. It's a good guess, but the serratus anterior is underneath the scapula and it kind of runs along the ribs. It doesn't make up your back armpit. It doesn't make up the posterior border of your axillary region. It runs on your ribs here. If it disappeared, you'd still have this everything back here. We're looking for things that... What?
The medial fibers of the trapezius?
No, actually. So hold on, Ms. Torres. No, because they don't run across the armpit. They hook to the scapula. They don't get over to the arm. You can't have an armpit if you don't get to the arm. So we got the rear deltoid fibers. But wait, Ms. Torres. Ms. Hanson, can you give me one? Anything that runs across back here.
The infraspinatus?
Perfect. Stop right there. The infraspinatus. Miss Nguyen. Don't worry about your book. She just said infraspinatus and she's correct. Anytime I say infraspinatus, you say what?
I say...
Teres.
I say in the...
Teres.
Shit.
You say teres.
Cherry.
Minor.
Minor.
Teres.
Cherry.
Minor.
Minor.
Good. Anytime I say infraspinatus, you say what?
Cherry. Minor.
Yes. And anytime I say teres minor, you say infraspinatus. So anytime I say teres minor, you say infra.
Infra.
Spinatus.
I know.
Spa.
Infra.
Infra. Spa.
Spa.
Nate.
Nay.
Us.
Us.
Infraspinatus.
Infra. Nayer.
That was pretty good. Yeah, those are hard words. So far we've got the rear deltoid back here. We've got the infraspinatus and the teres minor. Teres minor. Can somebody give me one, just one other muscle, somebody that crosses over back here?
Would it be the
Subscapularis? Yeah, I'll take it. Yep, you're right. It goes across there and it's on the back side. We'll take it. Subscapularis. Boom. Somebody else. One muscle.
Teres major.
Teres major does cross over there. Awesome. Now, thank you for that one. What would be the obvious next one now that she said teres major?
Oh, latissimus dorsi.
Yes, latissimus dorsi. Now, that's 6 muscles that cross over the posterior axillary border. Have we missed one?
Cotton.
What?
Cotton.
I don't know.
Cotton. I don't know that.
I don't know which muscle you're talking about. You can type it in the chat box if you want. You can type it. I got one more that I can think of.
The triceps brachii.
Triceps brachii is exactly right. Can you be even more specific, Miss Yanez?
The lateral head.
How about the long head?
Ooh. Okay, the long head.
Perfect.
Yeah.
But well done. So, if I rub this area properly back here, I am able to rub 7 muscles. 7 muscles can be found kind of in this posterior axillary border. Wow. 7 muscles. It's like a muscular party back here. Yeah. Pretty important. Cool. All right. My favorite number is 7. Good. Good. So, Miss Cooper, you said your favorite number was 7, right? Miss Cooper, let's review for everybody what the 7 muscles were with your favorite number that can be found that basically, by the way, some people can argue this a little bit, but can be found in this area. Basically form the posterior axillary border or the back of your armpit. There's a giant one that's found on the lateral side of your body and on the back side of your body. Huge, big muscle.
What's your latissimus dorsi?
Latissimus dorsi. Anytime I say latissimus dorsi, you say what?
Oh god. It's the teres major.
Teres major. Well done. Thank you. Then there's a rotator cuff muscle found under the spine of the scapula.
Oh, the infraspinatus.
Yes! Anytime I say infraspinatus, you say what?
Teres minor.
Yes, I am already so happy, everybody, because remember that latissimus dorsi goes with the teres major because latissimus dorsi is big, so it goes with major. Infraspinatus goes with teres minor because it's small, and she already got those, and those are the big ones, by the way. Then you've got the rear fibers of what's this kind of thing that inserts in the deltoid tuberosity and the rear fibers here? Starts with a D.
It's what?
Starts with a D. Inserts in the deltoid tuberosity.
Oh no, I know this one.
Yeah, it's the muscle that inserts into the deltoid tuberosity.
Deltoid tuberosity.
What muscle would insert in the deltoid tuberosity? The peanut butter muscle? The lollipop muscle? I wonder if it has anything to do with its insertion. Inserts into the deltoid tuberosity. What muscle would insert in the deltoid tuberosity?
Probably the deltoid.
Yes! The deltoid tuberosity. Yes, the deltoid inserts in the deltoid tuberosity. That's 5 right there. Bam! Miss Petrie kind of pointed out I'm so sorry, I don't remember who, but somebody pointed out the subscapularis. That's a tricky one to get. And then we just learned, Miss Cooper, about the 7th one. We just learned about it. It's the 3-headed muscle found on your arm. What's the name for a 3-headed muscle found on your arm? Tri means 3. What means heads?
Is it your tricep?
Yeah, but what means that? You are right, but what means heads? Tri means 3.
Oh.
What means heads?
Oh gosh.
Say seps.
Triceps.
Yeah, tri means 3, seps means heads, and what means arm? You don't want to break it. What means arm?
Oh, brachii.
Brachii. The 3-headed muscle found on the arm. Tri means 3. Seps. Seps means heads. 3-headed. Brachii means arm. 3-headed muscle found on the arm. Triceps brachii. Cool?
Okay, so
That was great.
seps means head and brachii means arm.
Yeah.
Okay, I wrote it.
Tri means 3. Brachii means arm, but seps, C-E-P-S, means heads. Biceps is a 2-headed muscle. Triceps is a 3-headed muscle. We will later learn about a 4-headed muscle, but not for a while.
Okay.
Cool. All right. Miss Balatic. Miss Balatic, what does seps mean? C-E-P-S?
Oh, we went over this.
Yeah, that's okay. We were just talking about it, by the way. I call on you guys to make sure you're focused, which is fine. Don't worry. Miss Cooper. Miss Cooper, what does seps mean? C-E-P-S.
Heads.
Cool. Miss Balatic, what does seps mean?
The head.
Cool. And what does tri mean?
3.
Yep. So what's triceps mean?
3 heads.
Yes. And what's brachii mean?
Arm.
Cool. So triceps brachii is the
3-headed arm.
Three-headed muscle found on the arm. But I like that, three-headed arm. We'll take it. Thank you. That is what it means literally. Awesome. All right, everybody. Cool. I think we only have, I hope we only have one more muscle. I love this little muscle. This muscle helps form the anterior border of your, or wall of your axillary region, the front of your armpit, along with pectoralis major, by the way. Pectoralis major has a lot to do with the front of your armpit, but coracobrachialis is a muscle named for its origin and insertion. Yeah? Miss Felix Osuna.
Yes.
This is the anterior part of a scapula and a humerus. So it'd be like if you could see through my body, you'd see this right here. There's a beak-like projection coming out the front. Beak-like projection. You can actually palpate it on people up here. Beak-like projection. What's this process called? It's called the something process.
Is it the
It is the coracoid process. Thank you. That's really good. It's hard to pull those kind of names out. Coracoid process. And what's another word for arm? Starts with a B.
brachii?
Yeah, brachii, whatever. So this muscle is called, this muscle goes from the coracoid process to the brachii, and it's called the coracobrachialis. It's named by its start and finish. Right? It'd be kind of like if we called I-17 Phoenix Flagstaff. Kind of. I mean, I realize it goes further than that, but my point is, it's named by its origin insertion. It's the muscle that goes from the coracoid process to the brachialis. And it sounds confusing the way they describe the brachialis, where it inserts, but let's figure out what they mean. Miss Hanson, I need your help here. So, we are looking at this arm right here, right?
Yes.
Okay. What do you suppose they mean by mid-humeral shaft in English?
In the middle of the brachii.
Yeah, this is the shaft. It's the middle of the mid-humeral shaft is here. Now, which side am I touching? Am I touching the anterior side, posterior side right now, lateral side, medial side?
I think you're on the anterior.
Yeah, I'm not trying to be tricky. Anterior. Which side am I touching now?
The medial.
No, not here.
Or lateral.
Lateral. And which side am I touching right back here now?
The posterior.
And which side am I touching here?
The medial.
Yeah. So what they're saying is this muscle comes from over here and inserts into the medial side of the middle of your humerus. Does that make sense, everybody? Cool. Really well done. I'm just trying to process the language with you because I think it makes it really confusing. I mean, they're talking about it correctly, and it's probably the way I would do it too, but you're just like, medial surface mid-humeral shaft? Like, whoa, you got to break it down. You got to be like, okay, it's the humerus. It's got a shaft. Middle of the humerus. It's got a medial side. It's actually got 4 sides. They're talking about inside, which makes kind of sense. It's inside my armpit, so it kind of makes sense it would grab over there. Yes. Yes. So, we've got this muscle, our final muscle, I believe, for today, I hope. It goes from here to here. Yeah? So let's go ahead and just... Goes like this. And it runs deep to a lot of stuff here. Goes like this. So if I pull this muscle, what action is that? I think I saw people mouth it. Good. Miss Petrie, what is it?
A flexion.
Yes. Yes. Yeah. Also, if my arm's way out here, Miss Hunter. Miss Hunter, I'm just saying your name twice because I know it's hard sometimes. Miss Hunter, if I pull this here, what am I doing?
If you pull that, it's adduction.
Thank you. So it can aid in a flexion or an adduction of the glenohumeral joint. Yeah. Yeah. I would argue it could actually aid in a horizontal adduction too. But that's just me. Cool. Good job, everybody. That was a lot of stuff. Yeah. Let me make sure that's it. Good. By the way, remember, this is a local contraindication. My dead center of my armpit is a local contraindication. Go ahead and poke yourself in there and tell me if it feels good. Dig right in there for a minute and tell me if that feels like something you should be rubbing. No. But grab your pec in front. It kind of feels kind of good, at least therapeutically. Grab your armpit and back. That feels good. That's where the 7 muscles are. So don't be afraid of this area. I massage the hell out of this area, but I don't dig right in somebody's armpit where there aren't any muscles. Remember, the armpit is created by the muscles. I don't massage the valley. I massage the mountains. Right? The mountain in front is made by my pectoralis major, which is huge, and my coracobrachialis, and probably the front of my deltoid, right? And the back is made by the lats and the teres major, and therefore the infraspinatus and the teres minor and the long head of the triceps and the rear delts. And I massage the heck out of that too. I just don't poke right in here because there's not any muscle. And there's a lot of nerves, arteries, and veins, and you're going to bruise them and cause problems. I don't really worry about this because I think the client's going to hit you before you get very far. But I also don't want you to be afraid of that area. I massage the heck out of the borders of the armpits. They're extremely important. And by the way, I would never, well, I might call them armpits with a client, but I wouldn't normally use that term. I'm trying to jump back and forth with terms so they get stuck in your head, if that makes sense. I want you to call this the axillary region. But, you know, as we're learning joints and all this kind of stuff, I try to switch back and forth. I hope that helps and doesn't make it worse. Yeah? Cool, cool, cool. Okay. Oh, and here's a great picture. If you guys can see the slide, this is why you don't press into the center of the axillary region, the dead center, because you're going to be hitting nerves and arteries and veins that feed the entire arm. And they don't have a lot of muscle over the top of them to protect them. Don't worry, they're not just going to burst open and the person's going to bleed out, but you can damage that area. It's not an area to go sticking your elbow into. Cool? All right. Let us stop there. No, let's let all this go for now. Yeah. Okay. Yeah. Okay. Let's stop there for now and do some quick review of everything just to put it in your head, and then we'll release you on the test for this section for these muscles, the open book test. Yeah? Yes. Okay. Miss Hunter, what action is this? What action is this, Miss Hunter?
That flexion.
Yes, ma'am, it is. What action is this?
That is extension. Oh, going all the way up.
Doesn't matter if it's going all the way up. It matters if it's going forward or not. Is this kind of happening in front of me?
Is it still flexion then?
Yes. Think about the way I teach. What's this?
Okay. Flexion.
Yeah. What's this?
More flexion.
What's this?
Flexion.
Yeah. Here's the one exception. I don't know if you can see the back of my leg. Maybe I'll use the skeleton maybe. Now, can you see, like, all right, I'm going to kick myself in the butt. What's that?
Okay. That's flexion.
It's the one flexion that happens behind me, yes. Good job. Thank you very much.
Okay.
Miss Petrie. Miss Petrie, what's this?
Extension.
Extension of my neck, yeah. What's this?
Extension.
Yeah. What's this?
Extension.
Yeah. And by the way, everybody, this is an extension too. It's in front of me, but it's moving back. Extension, yeah? Cool. Miss Petrie, what's this?
Extension.
What's this?
Extension.
What's this?
Extension.
Yes. It is opening up and curling. Thank you. Miss Hanson. Miss Hanson, What is this?
Abduction.
Yeah, and there's not enough camera. What's this?
Abduction.
Yeah, and what's this?
Abduction.
Yeah, and what's this?
Abduction.
Yeah. What's this? Watch carefully. What's that? Just guess.
Abduction.
Yes! What's that?
Abduction.
Thank you very much. It's been a pleasure talking to you. Miss Torres. Miss Torres, what's this?
Elevation?
Yes. What's this? Watch carefully.
Elevation of the mandible?
Yeah, temporal mandibular joint. Thank you. Wow. What's this?
Depression?
What's this?
Depression.
Yes. Thank you very much, ma'am. Miss.
You've been sleeping.
Yeah. Miss Bilotic. Miss Bilotic, what is... Are you there?
Yeah.
Cool. Miss Bilotic, what is this?
Extension of your neck?
What's this?
Depression?
Opposite of extension. Opposite of extension. Make sure you guys are watching other people when you're doing this. I think sometimes it's tempting to do other things, but all these questions I've just asked. So what's this? It's the opposite of extension.
Flexion?
Yes. Awesome. What's this?
Elevation?
Think of the way I teach. It's happening in front of me, just like this one happened in front of me. What's this? Flexion front. What's this called?
Flexion?
Yeah. What's this called?
Extension? Or flexion, sorry.
Yes, you're fine. What's this called?
Flexion?
Yeah. What's this called?
Flexion?
Yeah. What's this called?
Flexion?
Yes. Thank you very much, ma'am. Miss Stanley. Miss Stanley?
Yeah.
What am I doing with my glenohumeral joint right now?
It looks like a very, very slow, weird extension. I don't.
It is an extension. Thank you. What am I doing with my humeral ulnar joint, my elbow now?
Extension?
Yeah. What am I doing with my wrist right now?
Extension.
Yeah. What am I doing with my digits right now?
Extending.
What am I doing with my neck right now?
Extending.
What am I doing with my spine right now?
Hurting it, but extending.
Ah, thank you. Awesome. Okay, everybody. Cool. Let us review muscles that we've done so far. We've done all sorts of muscles. Yeah? Yeah. Miss Monreal, you nodded with confidence, and I like that. I like that. Cool? Miss Monreal, can you name two muscles that would elevate my scapulothoracic joint? So they're not attached to my arm. They're attached to my scapula because they're going.
Penis and levator scapula.
Oh, wow! What did she do? She picked two muscles above the scapula and knew that if they contracted, they would lift the scapula up, right? Trapezius, levator scapula, the upper fibers, the trapezius, both found up here, would elevate my scapula. Yeah? Miss Monreal, can you name one muscle that could elevate my scapula but could also extend, if it's working bilaterally, my head?
Trapezius?
Yeah, she's absolutely right. It's back here. If you grab both sides, you're going to pull back my head. So you can lift up my shoulders, you can pull back my head. Yeah, awesome. Well done. Cool. Thank you. Miss Harper. She's like, Miss Harper. Appreciate your enthusiasm. Can you name a muscle that shares an attachment? It is actually, its origin is the trapezius's insertion, and it can allow me to do an adduction, a flexion, and an extension depending on which fibers are working, and also a horizontal adduction, actually a horizontal abduction depending on which fibers are working. Can you name a muscle that shares attachments with the trapezius, because sometimes they do work in symphony together? It's the what?
Something major.
Something what?
Major?
Okay. What is the insertion of the trapezius? It's the lateral 1/3 of the clavicle, then the what process?
The coracoid process?
No, the acromion process.
That process.
Yeah, that's what you meant though. And then the spine of the what? What's this called?
Spine of the scapula.
Yeah, that's where the trapezius inserts. What is this the origin for? What has an origin of the lateral 1/3 of the clavicle, the acromion process, and the spine of the scapula?
That's the greater typical.
What muscle? What muscle comes off?
Oh, that's the deltoid?
Yes. And the deltoid is a muscle that shares attachments with the trapezius, can do an adduction, a flexion, an extension, a horizontal adduction, and a horizontal abduction depending on which fibers are pulling it around. Cool. Thank you. Thank you. Miss Yanez. Miss Yanez, which two muscles, I think it's only two, sometimes I'm wrong by the way, but I think it's only two. Which two muscles do we learn today that can do a flexion of the humeral ulnar joint, the elbow? Which muscles allow me to do this? I'm sorry, what?
The tricep brachii of the elbow.
Yeah, allow me to do a flexion.
Flexion.
Flexions happen in front, so these muscles should be found in front.
The bicep brachii.
Yeah.
And the
Yeah.
brachialis.
And the brachialis. Yeah, which one of those muscles is deeper?
The brachialis.
Yeah, well done. Thank you. Okay, Mr. Kondaris, Miss Yanez just helped me do this with my arm, but now I need to extend it back out. Which muscle is going to help me extend my arm back out and actually extend my humeral ulnar joint?
Tricep.
My tricep. Thank you very much. Is that the only thing the tricep can do, sir?
No.
No, because it crosses over another joint. What's this joint here? You like to abbreviate it.
The GH joint.
Yeah, what does GH mean?
Coronal humeral.
Thank you. And if the tricep, which head, by the way, crosses over?
The long head.
Yes, the long head. And if it contracts, it can allow me to do this, which is called a what?
Depression.
Not this. Adduction or this?
Is that extension again?
It is extension. Thank you. Very well done. Good, good, good. Cool. Awesome, awesome, awesome. Miss Stanley. Miss Stanley, what are the names of my 4 rotator cuff muscles? These are the muscles where there's one above here, above the spine and scapula, 2 below, really, and 1 underneath.
Supraspinatus, infraspinatus, teres minor, subscapularis.
Bam! Thank you so much. Thank you, thank you, thank you. Yeah. Cool, cool, cool. Miss Torres. Miss Torres?
Yes?
Which one of those 4 muscles, of those 4 rotator cuff muscles, helps me do an abduction of the glenohumeral joint?
Supraspinatus?
Supraspinatus, thank you very much. Miss Bilotic, which one of the 4 rotator cuff muscles helps me do an abduction of the glenohumeral joint?
An abduction?
Yep.
Sorry, I'm taking my notes.
So let me show you a little trick. Miss Belodic, this will help you a lot. Just pay attention for just 1 second. Miss Torres.
Yeah.
Miss Torres? I just asked you a question. I just asked you a question. What was it, Miss Torres?
Which muscle abducts the humeral,
Glenohumeral joint, yeah. Abducts, yeah. And what was the answer?
supraspinatus?
Supraspinatus. And then Miss Belodic, just to let you know, I'm just helping drill you guys, so I just ask you the same question quite often. But I'm also making sure you're listening to the last person. So, supraspinatus was the answer to Miss Torres's question. I'm going to ask you the exact same question. Which of the 4 rotator cuff muscles helps to abduct the arm?
Supraspinatus.
Yeah! Cool. Thank you. Miss Nguyen. Miss Nguyen, which of the 4 rotator cuff muscles helps you to abduct the arm? It's got to be on top.
The cinema.
What?
You add me again.
All right, I just asked Miss Belodic this question. We're gonna go back to her really quick to review. Listen to what she says, right? Miss Belodic, which of the 4 rotator cuff muscles helps me do this? Do an abduction.
Supraspinatus.
Supraspinatus. Hey, Miss Nguyen, which of the 4 rotator cuff muscles helps me do this?
Supinator.
Yeah, supraspinatus.
Supraspinator.
Yeah, spin,
Span.
atus.
Ator.
Supra,
Super.
spin,
Span.
atus.
Ator.
Supraspinatus.
Supraspinator.
Supraspinatus. Supraspinatus. Cool. Awesome. Awesome, awesome, awesome. All right, guys, I'm not going to keep drilling you because you want to get to the test. You've been wonderful. Thank you. I'm going to release the test right now. Hold on. Let's get to that. Do-do-do-do. Do-do-do-do.